Knee arthritis is one of the leading causes of disability for people above 50 years and older, and now more than ever, people in earlier 20s or 30s getting osteoarthritis of the knee more than ever before. In most cases, for different reasons, knee cartilage slowly starts to break down, and cartilage is a strong, elastic, connective tissues found between bones and inside the joints. Its job is simple but vital. It allows one bone to move smoothly over another without friction. And over time, this important tissue becomes thinner, worn out or cracked. As soon as cartilage damage starts, inflammation follows. That inflammation causes pain, swelling, stiffness, and limited movement. And these processes often develop slowly and last for many years. From my experience, most people either ignore early symptoms to treat them completely or in the wrong way. And after 26 years working with the patients that have knee osteoarthritis, one thing is clear, my dear viewer. When you have knee osteoarthritis, usually when you realize it, the problem that you have right now is very serious. Those knee problems, knee cartilage deterioration, begin 5 or 10 years before. But you usually ignore the symptoms and use chemical medications to cure your knee arthritis, and right now you're in maybe chronic stages of knee osteoarthritis. What makes knee cartilage special? Cartilage is not muscle, it is not bone. It is stiffer than muscle but still flexible. And it's not rigid like a bone. Cartilage cells, called chondrocytes, are responsible for production of collagen, elastin, and other substances that give cartilage its strength and elasticity. But cartilage regenerates very slowly. Once it is severely damaged, recovery becomes extremely difficult. And that is why prevention is everything, and that's why the correct nutrition plays a major role. And in today's video, I'm going to explain you in detail most important vitamins that help a lot of my patients with knee osteoarthritis, and I believe it can help you a lot. My first recommendation is going to be vitamin C. Vitamin C is crucial for the collagen and the cartilage. Most people associate vitamin C only with immunity and colds, but its role in the body goes much deeper than that. Vitamin C is absolutely required for collagen production, and collagen is the main structural protein that gives strength and elasticity to cartilage, tendons, ligaments, and joint capsules. Without enough vitamin C, collagen fibers become weak and poorly organized. This means that cartilage repair slows down and existing damage progresses faster. Vitamin C also acts as a powerful antioxidant, and it helps neutralize free radicals inside joint that accelerate inflammation and cartilage breakdown. In the most cases, you have knee cartilage destruction because poor diet, maybe a couple decades before you even realize it. You take a lot of chemical medications, you are overweight, and above all those, you have chronic stress, poor sleep, and this is all in the main cases why you have knee cartilage destruction. In the people with knee osteoarthritis, low vitamin C levels are often linked with more pain, stiffness, and slower recovery. Proper vitamin C intake supports the body's natural repair processes and helps protect remaining cartilage. Recommended daily dose. Listen to me, my dear viewers. If you have knee cartilage problem, if you have knee osteoarthritis longer than 3 months, usually if you watch this video, you have probably for the years knee cartilage problem and knee osteoarthritis. You will need minimum vitamin C 1000, 2000, even couple thousand milligrams vitamin C daily, because usually you have chronic deficiency of vitamin C because your knee cartilage and knee arthritis is on this right now in this special place. You know, my dear viewers, chronic deficiency in vitamin C slowly but surely deteriorates and destroy your knee cartilage. Second vitamin is going to be vitamin D. Vitamin D is special because it behaves more like hormone than typical vitamin. Vitamin D is special because it produces your body in your skin when it's exposed to the sunlight. This form of vitamin D is then stored in the fat tissue and transported through the blood to the liver when it's converted in its active form. Vitamin D is essential for proper calcium absorption and distribution in the body. And without enough vitamin D, calcium cannot do its job correctly, even if you consume enough vitamin D. This directly affects bone strength, joint stability, and the cartilage health. And the chronic deficiency in vitamin D is strongly connected with cartilage destruction, my dear viewers. Probably more than 80% of you have vitamin D deficiency, and you don't even realize it. And you have vitamin C, vitamin D problems maybe for 5 and 10 years, and you think that your knee cartilage and knee osteoarthritis is because maybe something else. Sun exposure is most natural source. In daily 30 to 60 minutes of sunlight per day, depending on the skin type for the season, is going to be enough. However, modern lifestyle keeps most people indoors, and when sun exposure is insufficient, vitamin D must be obtained from the food or supplements on regular basis. This means, my dear viewers, you will need eat each day, if you have knee osteoarthritis, vitamin D, vitamin C foods. If you don't do this, in most cases you do not do this regularly and properly because you have the poor diet. You must take 100% organic form supplementations of vitamin D, vitamin C, especially if you don't go outside when it's sun, that you absorb good quality vitamin D from the sun. Vitamin D works slowly but deeply. Its beneficial comes for consistency, not from the short-term use. Here's vitamin C and vitamin D food sources. And vitamin C is found in many fresh fruits and vegetables that supports collagen production and joint health. Good sources include kiwi, red bell peppers, oranges, lemons, grapefruit, mandarins, strawberries, papaya, pineapple, mango, and guava. Vegetables rich in vitamin C include broccoli, Brussels sprouts, cabbage, spinach, kale, tomatoes, and the fresh parsley. And also rose hip and currants are especially high in vitamin C and are almost always overlooked. You have food right now that you know that you need for your knee cartilage, and you have the supplementation in correct daily dosage. But I'm gonna explain everything that you don't realize it. What will happen to your knee if you rely only on chemical medication from right now at this point that you are in the next 12 months? In my experience for almost 30 years working with a patient. Let me explain what you usually see after 1 year when a person treats the knee osteoarthritis only with medication. In the first month, pain is often quieter. That creates a false sense of improvement. Because pain is lower, movement becomes more limited. Muscle around the knee slowly weaken and the joint becomes less stable. Cartilage wears do not stop, it continues quietly in the background. After 6 to 9 months, stiffness becomes more noticeable. Getting up from the chair takes longer, stairs become difficult, and walking distances shortens. Swelling appears more often, the knee feels heavy by the end of the day, and the painkillers need to be taken more frequently. Sometimes stronger medications are added, but cartilage thickness does not improve, joint mechanics do not recover, and the inflammation becomes chronic. After 12 months, many people feel frustrated and confused. They did everything that were taught. They took their medications, but knee function is worse than ever before. If you have these kind of problems and you feel this, as I said it right now, please comment below your experience with knee arthritis medications. I see it every time for the last 26 years. If knee medications, knee injections, whatever, can cure your knee osteoarthritis, I will be using them every day. But I don't use them for the last 26 years because I realized it when I talk to my patients and make a special program with nutrition, special natural remedies, and healthy habits. my patient get a lot better. Many of them cure this knee osteoarthritis completely. Pain relief is not the same as joint protection. Silencing pain does not stop degeneration. And real change begins when nutrition supports repair, movement restores circulation, and the lifestyle removes constant joint overload. And just two information at the end of the video. My dear viewers, if you're watching me right now for any country in the world, you need to realize that if you have knee osteoarthritis, that is a chronic condition, you have pain, stiffness, swelling that lasts for the months, for the years, you can call to my office right now, and we will give you information how we can help you to be healthy again. We work with the patient all around the world. You just need to contact us on our phone number directly, of a Viber or the WhatsApp, whatever, and we will give you information how you can be healthy with your knee again. This is our specialty. This is only for the people that have chronic problems with knee osteoarthritis. Any country, anywhere in the world, you can contact us. Second really important information is going to be supplements that help my patients get good quality care of knee osteoarthritis in these early stages of knee osteoarthritis. As I said it before, you need vitamin C, you need vitamin D, but you need a lot of more minerals that I talked about in my videos before. And if you want to know what I use and what exactly supplements I use with my patients that have 100% organic, all minerals, all vitamins, especially for your knee osteoarthritis, call us, contact us, and we will give you specific what is best for you, and it is going to help you a lot if you have a beginning of knee osteoarthritis or some kind of middle stages knee osteoarthritis. In these cases, you don't need our specialty. You can contact us. We will give you information what we use with our patients, but in chronic stages, we can help you, my dear viewers. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy, and rehabilitation. Through my MarioLab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore the quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.